I'm Dr. Jumamil. I'm a board certified primary care internist and general preventive medicine fellow at Mount Sinai, and I'm also board eligible in obesity medicine as well. Today, we're going to talk about something very important to our everyday well being and long term health, how obesity affects our respiratory health, and some exciting new treatments are emerging to help manage this. We'll cover the links between obesity and respiratory illnesses like sleep apnea, asthma, and even COVID-19. And at the end, I'll introduce some of the newer classes of medications that you've probably heard of, like the GLP-1 agonists, which are showing some promise in managing obesity. So to go over obesity, I just wanted to highlight that it is more than just weight. Obesity is a medical condition where excess body fat affects your health. So we know that excess body fat is associated with over 200 diseases. And the most common ones we think of are heart disease, diabetes, stroke, and even some cancers. The CDC recognizes up to 13 cancers that are directly associated with obesity. Obesity is measured using the body mass index, or BMI, and this is calculated as the weight in kilograms over the height in meters squared. And a BMI of 30 or higher is considered obese. So this isn't a perfect tool. It's a screening tool that would apply to most people. Something to realize is that because it's based on weight and height, someone like a bodybuilder may have a BMI of 40 because they technically weigh a lot, but their body composition is mostly muscle. So that would not be considered obesity. Something that would be more insightful would be abdominal obesity. So looking at one's waist circumference, and abdominal obesity is more associated with the comorbidities like heart disease, diabetes, stroke, etc. And generally for women, a waist circumference of 35 inches and more is considered abdominal obesity. And for men, it would be a waist circumference of 40 inches or more. I do want to highlight that unfortunately, people with obesity can experience a lot of stigma. Obesity is a complex disease, and it's not simply a matter of not eating right or not exercising enough. Studies show that up to anywhere between 40 to 70% of obesity can be due to genetics. So there's a lot of components that we do not have control over. We don't have control over our genetics, for example. But environmental factors are also a key component that relate to obesity. So overeating certainly can lead to obesity and lack of physical activity, but a lot of medications that people are on can also lead to weight gain. For example, people on insulin who have diabetes can gain weight because insulin can lead to weight gain. Same thing with autoimmune disorders that require medication such as steroids. Steroids are known to make people gain weight. And other issues such as mental health issues, food access, if people can't access healthy foods for many different reasons, those can all lead to obesity. It's on the rise, certainly in the United States. Obesity affects about 42% of US adults, and that is on track to be 50% of US adults by 2030. And obesity is now affecting 1 in 5 children. On the right here, you can see a map where the colors in darker red show a higher rate of obesity in those states. So obesity affects all 50 states, but really we're seeing in the southern states and Midwestern states are the highest concentration. Going on to the relationship with respiratory diseases. Excess fat, especially around the abdomen, can physically limit lung expansion. So it makes it harder to breathe. And this restricts your airflow, leading to a reduced ability to get oxygen into the body and eliminate carbon dioxide. So in this picture here on the left, you can see this normal lung volume here. But in a person on the right who has obesity, you can see that lung volume is actually much smaller. So they can't expand the lung as much. The other thing people may not realize is that the fat cells themselves secrete inflammatory hormones that can cause chronic inflammation in the lungs. So how does this manifest? So one of the most common issues with obesity is something called sleep apnea, where extra fat around the neck can block airways during sleep. And this can cause snoring and pauses in breathing. Oftentimes, folks with sleep apnea may not feel well rested in the morning when they wake up. That's because they've literally stopped breathing in their sleep and their brain has not received enough oxygen. And oftentimes, people will say their sleeping partners complain that they snore a lot. Sleep apnea does increase the risk for heart disease and stroke. So it's really important that this gets treated. And some people may be familiar with the continuous positive airway pressure machine or CPAP machine seen here on the right. And what it does is that it uses mild air pressure to keep the airways open. But again, that's a very temporary solution. And oftentimes people don't feel comfortable with the CPAP machine. So weight loss of the excess fat would be helpful in maintaining the airways open when one sleeps. Another respiratory illness is asthma. Obesity increases the likelihood of developing asthma because the fat tissue, again, produces inflammatory substances that can worsen asthma symptoms. So people with asthma can have more frequent exacerbation and have reduced response to medication. So even when they treat it with their inhaler, it may not work as well as it should. So airway hyperreactivity, that's basically your asthma gets triggered by an environmental factor outside and it causes your airways to narrow due to all the inflammation. And of course, this decreases one's quality of life. COVID-19, I know this is very fresh in people's minds. We do know that people with obesity were more likely to suffer severe complications from COVID-19. And that's again due to inflammation from excess fat. And it makes it harder for the body to fight infections, particularly COVID-19 and other viruses. Again, it's important to manage obesity through eating a healthy diet, so more fresh fruits and vegetables as possible, physical activity, and behavioral modification. But oftentimes that's not enough for folks to have a meaningful weight loss, and it's very difficult to do those things. So there's also medications, and there are now newer medications on the market, as well as bariatric surgery and endoscopic devices as well. So going on to some of the newer medications, the ones that you've heard of, such as Wegovy or Zepbound, these are GLP-1 agonists. What that means is that it mimics the GLP-1 hormone, which helps regulate blood sugar and has a significant effect on appetite and weight loss. So these medications work in the brain to reduce hunger and make one feel full sooner, and also slows down how fast the stomach is emptying. And what we see with these medications is about a 15 to 20% weight loss, which is huge and can certainly help people who are dealing with the different diseases associated with obesity. So these are the approved medications. These are all injectables. Wegovy is semaglutide. That's a GLP-1 agonist. And Wegovy, the brand, has been approved for weight loss. Wegovy is the same as Ozempic. see they're both semaglutide injectables. The difference with Ozempic is that this brand is approved for diabetes and Wegovy is approved for weight loss, as well as reducing heart disease risk. Even though they're both semaglutide for billing purposes and what insurance sees, it's whether or not you have diabetes, then you can be prescribed Ozempic. And if you don't have diabetes, then you would be given Wegovy instead. On the right here, you see Zepbound. This is tirzepatide. So this combines GLP-1 agonist with another hormone called GIP, and it's a hormone secreted in the gut that also contributes to lowering your appetite and slowing down gastric emptying, the stomach, how fast it goes through your stomach. People see a higher weight loss with Zepbound, up to 22%. And Zepbound is for weight loss, and Mounjaro, which is the exact same thing, is marketed for diabetes here. Both Wegovy and Zepbound are once weekly injection. On the bottom here is Saxenda liraglutide. It's also a GLP-1 agonist. The difference with this is that it's a daily injectable as opposed to a once weekly. And Saxenda is for weight loss, and similarly, Victoza, which is the same medication, is for diabetes. All these medications are approved for adults with a BMI of 30 or higher, which is obesity, as we said, or a BMI of 27 or higher with other weight-related health conditions like diabetes or high blood pressure. Because obesity is a chronic disease like diabetes or high blood pressure, it's considered to be a long-term medication, and we expect folks to gain weight back if they suddenly stop it. The common side effects people have are nausea, vomiting, and gastrointestinal upset or stomach upset. And it's not for people who are pregnant, anyone with a family history or personal history of medullary thyroid cancer, or multiple endocrine neoplasia type 2, which is a type of hormone disease, or people who have had pancreatitis or inflammation of the pancreas. In conclusion, obesity significantly impacts respiratory health, such as sleep apnea, asthma, COVID-19, and other respiratory illnesses, in addition to over 200 other medical conditions. Lifestyle changes are key, but there are newer medications that can help people lose weight. Not all insurances will cover medications for weight loss only. Unfortunately, a lot of insurances want people to wait almost until they've developed complications of diabetes and other things. So even though these medications are FDA approved for weight loss, not all insurances will cover it. These medications have been on the market for not a very long time. So we can't comment on like 20 years down the road what is it going to look like. We just can't. But those studies we do see are showing remarkable improvements in other facets of people's lives due to obesity being addressed. So fertility has increased, and that was due to like obesity causing PCOS and all these different things. Like heart disease is remarkably improved. People don't have acid reflux, like things you wouldn't even immediately associate with obesity have now improved because people are losing excess fat.